In today's lecture, I am going to discuss about introduction and classification of antiarrhythmic drugs. Antiarrhythmic agents are the drugs which are used in the treatment of heart arrhythmia. Heart rhythm problems or heart arrhythmias occur when the electrical impulses that coordinate your heartbeats don't work properly, causing your heart to beat too fast, too slow, or irregularly. Sometimes heart arrhythmias may feel like a fluttering or racing heart and may be harmless. However, some heart arrhythmias may cause bothersome and sometimes it becomes life-threatening. When a heartbeat is irregular, heart may not be able to pump enough blood to the body. Heart arrhythmias can be associated with serious symptoms that can affect your ability to function, and lack of blood flow can damage the brain, heart, and other vital organs. If irregular heartbeats remains frequent for a longer duration of time or chronic in nature, they can be serious. Troublesome arrhythmias can be made worse or can be caused by a weak or damaged heart. Categories of arrhythmia. There are several categories of arrhythmia, including bradycardia or a slow heartbeat. When the electrical impulses that tells your heart to contract is not formed in your heart's natural pacemaker, the SA node, the natural rhythm of the heart will affect. Next is tachycardia or a fast heartbeat. This is an irregularly fast heart rate, 100 beats per minute or more. Depending on where the fast heart rate begins, will determine what type of tachycardia it will be. It can be classified as ventricular or supraventricular. Next is flutter or fibrillation. It represents irregular heartbeat. And last one is premature contraction. Due to premature contraction, early heartbeat occurs. Symptoms of arrhythmias include fast or slow heartbeat, skipping beats, lightheadedness or dizziness, chest pain, shortness of breath, and sweating. Factors affecting heart's rhythm. Many factors can affect your heart rhythm, such as having or had a heart attack, smoking, congenital heart defects, and stress. Some substances or medicines may also cause arrhythmias. Antiarrhythmic drugs. Antiarrhythmic agents, also known as cardiac dysrhythmia medications, are a group of pharmaceuticals that are used to suppress abnormal rhythms of the heart, such as atrial fibrillation, atrial flutter, ventricular tachycardia, and ventricular fibrillation. The ultimate goal of antiarrhythmic drug therapy is to restore normal rhythm and conduction. When it is not possible to revert to normal sinus rhythm, drugs may be used to prevent more serious and possibly lethal arrhythmias from occurring. Antiarrhythmic drugs are used to decrease or increase conduction velocity, alter the excitability of cardiac cells, and suppress abnormal automaticity of heart. Classification of antiarrhythmic agents. Antiarrhythmic agents are classified in four main classes. Class 1 includes sodium channel blockers, Class 2 beta blockers, Class 3 potassium channel blockers, and Class 4 calcium channel blockers. Besides these categories, few miscellaneous compounds are also used. For example, adenosine, electrolyte supplements like magnesium and potassium salts, digitalis compounds like cardiac glycosides, and atropine related compounds which are muscarinic receptor blockers. So that's all for today. In the next class we will discuss detailed classification and mode of action of antiarrhythmic agents. Thank you.